I'm going to talk about policy evaluation in broad terms, although drawing quite a lot on my experience in health policy. But the overall focus, if this works, doesn't do, okay, will be on policy evaluation in general. So I'm going to talk about what I mean by policy evaluation, some of the perceived problems that people often discuss in systems like New Zealand and in the UK around evaluation, and the welter of proposals that have come forward in the last 15 or 20 years to improve the way in which evaluation is used in policy making, and then to try and reflect on some of these proposals and to try and critique them and look at their feasibility, the realism with which they've been put forward, and then draw some conclusions and observations. So just a bit of orientation. I'm mostly talking about what I'll call external evaluation. In other words, evaluations undertaken by people outside of policy shops, but not exclusively. But that's probably the default. The sort of the funded external research that, or the research undertaken by people whose job it is principally to look in a somewhat dispassionate way at policy making and policy outcomes. I'm interested in both ex ante and ex post evaluation because quite a lot of proposals and discussion has been around both aspects. I'm only thinking though about evaluation that involves some kind of new data analysis or collection. And and in my mind's eye is the UK and New Zealand as archetypal or sort of typical places where this sort of discussion goes. And I'm thinking about national level social policy in the main. And for those of you who want to know about difference in difference analysis or interrupted time series or other such aberrations, I'm not going to talk about the technical aspects of evaluation at all, or about the sort of, if you like, the dissemination and knowledge transfer aspects of evaluation, the kind of shifting of knowledge from A to B. They're widely discussed, and I've spent years worrying about them, but that's not what I'm going to talk about. But I am, as Grant says, going to partly draw on experience running what in the English Department of Health is referred to as a policy research unit. The Department of Health funds 9 research units in addition to individual research projects, and this was the brief that the unit that I run was given when we competed for it. So this is a unit designed to improve the department's capability for evidence-based policy making, to strengthen the use of evidence in the initial stages of policy making, and that's the sort of particular interest of this unit. And to do this by supporting or undertaking evaluation of policy pilots or demonstration initiatives. So that's where I'm coming from. This is particularly my recent experience and what sort of motivated my reflections on really what have I been engaged in. This is for the last about 2 years. But it's also based on having done a lot of evaluation work for government in the health field over about, as Grant said, about 30 years. What do I mean by value of evaluation? I'm not using it in a kind of rate of return sense. I'm simply seeing value as I put it there, better potential to be used or to use evaluation. So that I think a lot of the proposals and ideas and discussion about the way evaluation is or is not used or is misused or underused has implicit in it, if we only did X, then at least it would be in play, or we could make more use of it. And then there's an assumption, therefore, that we could improve policy making, and then at some point we might even improve the results of policy. So that's my current working definition of value. I don't want to spend too much time on that, although since it's in the title I thought I'd better mention it. And evaluation, I've just taken one of the textbook standard definitions. What I mean is systematic assessment of the operation and or the outcomes of a programme or policy. That's Carol Weiss's classic definition. And my orientation, I suppose, from the start, this is sort of, I'll give you the answer at the beginning if you like, is that to me, understanding and improving the value of evaluation, and why I'm not talking at all about the technical aspects, is that essentially this is almost entirely the result of the way the policy process is structured in a particular jurisdiction, the norms, the values, the expectations of the policy process rather than the features of any particular evaluation. That those may be necessary, but they're by no means sufficient, and sometimes they're relatively unimportant if you're concerned about the use or the value of evaluation. So that for me, the way I think about this is I think first about the policy process, and then I say, well, actually, there's hordes of people who worry about diff-in-diff analysis or whatever the appropriate methodology is. That's the least of our concerns. And the other sort of bit of my sort of autobiography over the last 6 months is I first gave this talk in July, and I was relatively optimistic, and then since then I've become rather depressed about the potential to improve the value of evaluation in a policy context like New Zealand or England or the UK. And what I'm grappling with at the moment is to find the mystic third way between, on the one hand, a kind of naive, rationalist, sort of modernist view that all we need is better techniques, and we apply them to ever more complex policy problems, and we will therefore improve the value of evaluation and the quality of policy. And on the other, a kind of postmodernist, relativist, nihilist position which says that actually it's all far too hard, policy making is far too complex, and we should basically just accept the fact that most of what we do in public policy is motivated by values and ideology and the mobilization of bias, and therefore we just have to kind of live with the status quo and its messiness and its inconsistencies and the frustrations of researchers and the marginalization of intelligent commentators or whatever. And I sort of veer between these. Anyway, my view at the moment is that we can't give up on improving the quality of policy making. We can't give up on evaluation, but we have to steer a very explicit course between the sort of modernist fallacy and the postmodernist fallacy. There we are. You can leave now if you want. The rest of it's just detail. Right. So, what are the problems people perceive? Now, this is a sort of I didn't realise that I didn't have the term stylised fact in my. I'd never come across it till I worked in the New Zealand Treasury. But here are some stylised facts about the perceived problems with policy evaluation over the last 20 years, and you'll hear them in policy documents in this country and in many parts of Western Europe, but particularly in the UK. First of all, a lack of understanding of the potential benefits of evaluation. And lots of concern that sometimes evaluation is denigrated as being too late, irrelevant, unreliable, incomprehensible, and embarrassing. Lack or insufficient commissioning of evaluation, but also insufficient consideration of the needs or requirements of evaluation and evaluators in the policy process. So for example, not thinking carefully enough about how actually you could make, with a sort of subtle change, you could make a policy more easily evaluable than otherwise. And then the huge literature on the use, misuse, underuse of evaluation. Lots of discussion, about the lack of analytical skills within government to understand and make good use of what's being produced externally, and so on. So kind of concerns about suppliers. And increasingly, and particularly recently, a sort of sense that many areas of public policies and in social policy are sort of lagging behind the health sector, that health is this sort of paradigmatic example of what you can do when you get it right, and it's all about the sophistication, the availability of data, the use of evaluation, and particularly the clinical trial as the sort of epitome of what we should be aspiring to more widely, for not just an evidence-informed, but possibly for some people still an idea of evidence-based policy making, although that notion has come under an awful lot of scepticism and attack. And now, keeping this dialogue or debate going over most of that last period has actually been probably more the role of researchers for self-interested reasons to continue that discussion. But periodically, decision makers also get interested in this topic, and in the UK this was very prevalent in the 1960s. There was a huge amount of discussion, US, UK, about improving policy making using evaluation. The late 1990s, an explosion of interest in the UK under Tony Blair with the sort of modernising policy series of government white papers, a lot of activity at the core of government there. And again, it's come back in the UK And it's associated with basically a wider critique of the civil service and its capability, competence, motivation, skills, and so on. It usually comes back through some wider debate, and I think the same thing you can see in New Zealand, that where evaluation is widely discussed as a kind of core thing that we ought to be doing more of, we ought to be doing it better, we ought to be doing it more readily. In New Zealand, the review of the centre, which was obviously a much more wide-ranging review, included a lot of discussion about probably mostly sort of evaluation within the government system. We got managing for outcomes, which is again all about, well, where do these outcomes come from? Well, some of it has to come from evaluation. And the Better Services, Public Services Advisory Group, again reiterating this call for more and better evaluation, more reflective, rational policy making. Although I think in New Zealand it's been perhaps a bit more focused on the setting of targets and the measurement of outcomes and the coordination of this across different sort of silos or sectors of government, rather than necessarily a much more detailed focus on, well, how are we actually going to bring evaluation into a policy process. But that may be just my sort of rather poor reading. And it, at the moment, sort of fueled by financial stringency, this is popping up all over the place in different forms. So the Obama administration in its social policy investment decisions has got a highly sort of rationalistic, at least model in mind of priority setting and relating that to evaluation. Then in the NGO sector in the UK, we've got this Alliance for Useful Evidence, which is across a number of other NGOs trying to sort of act as an advocate for better evaluation. And the French, for example, have got the special fund, experimentation fund for youth. It's a rather unfortunate translation. I don't think it's about experimenting on youth. Well, perhaps it is. It's about experimenting on policy associated with young people and their longer-term outcomes. So it's a very explicit focus on one particular group. And the journalists have got in on it as well, or science writers. Here's Henderson in the Geek Manifesto. But you will have seen Ben Goldacre's writings, perhaps his Bad Science book from his Bad Science column in The Guardian. Basically, this is probably one of the more sophisticated of these calls for more evaluation. And he at least has the modesty to point out that it's rare for scientific evidence to mandate a single solution to a policy problem. But what he's recommending is that ministers should ensure that they do take scientific advice on questions to which it is most pertinent into account. Above all, politicians and civil servants should not be allowed to get away with laying claim to evidence-based policy when decisions have actually been taken by other means. And he spends the rest of the book laying out in detail how he thinks the system needs to change to make that more of a reality. So I just pulled together a few of the covers of some of these reports. So you'll see why we need to create a NICE for social policy, which I'll talk about in a minute, National Institute for Health and Clinical Excellence. So that's a kind of this alliance for better evidence, pushing Institute for Government, a newish government external think tank about improving governance in the UK, pushing, and it's Making Policy Better initiative. The Civil Service Reform Plan in the UK talks about better use of evaluation, and so on and so on. And perhaps the most stark example, this is a thing called Test, Learn and Adapt, and that's published by the Cabinet Office, advocating the use of randomised controlled trials in public policy making. So, but these proposals obviously fall into sort of demand side and supply side proposals. On the supply side, there's probably been the longest setting sort of run of proposals and ideas. But at the moment, what we're seeing is a lot more discussion that researchers and evaluators need to make a lot more effort in sort of ex-ante evaluation. But perhaps in some of the countries with bigger research infrastructures, we've rather overdone the ex-post evaluation, and we need to engage much more closely with modelling work and other assessments so we can, as the jargon now says, answering today's problems today rather than yesterday's problems tomorrow. And that researchers should be more willing to use the best possible rather than perhaps the gold standard of evidence, so more emphasis on rapid synthesis and so on. A greater willingness to engage with policy decisions and policy makers and to offer advice rather than simply wanting research grants.